Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now we're looking at the mitogenic signaling pathway. So this is not mitogenic, it is the inhibitors. To be specific, it is the inhibitors of the mitogenic signaling pathway. Now to begin with, the APC gene. APC gene, the protein involved is the adenomatous polyposis coli protein, and so it is APC. The function is the inhibitor of the WNT signaling. Next is the familial syndromes. It includes the familial colonic polyps as well as the carcinomas. So how is this sporadic cancers? The sporadic cancers, it includes that of the stomach, colon, pancreas, as well as the melanoma. Now, moving on to the NF1. What is meant by NF1? NF1 is the neurofibromatosis, and the function is the inhibitor of the RAS. So it's a RAS inhibitor as well as the MAPK signaling. So the familial syndromes, it includes the neurofibromatosis type 1, the neurofibromas, and the malignant peripheral veins, nerve sheath tumors. Now sporadic cancers, it includes a neuroblastoma as well as the juvenile myeloid leukemia. Now let's move on to the NF2. NF2 is the protein involved is merlin. Merlin is a protein involved. The function, it is a cytoskeletal stability. It's a skeletal stability, and there is a hippo pathway signaling. There's a hippo pathway signaling. Now, how is the familial syndromes? The familial syndromes, it involves the neurofibromatosis type 2. It is a caustic, the schwannoma, as well as the schwannoma and the meningioma. So the sporadic cancer includes the schwannoma and the meningioma. Next is the PTCH. So what is meant by the PTCH? The PTCH is the protein. It is patched, and the function is includes the inhibitor of the hedgehog signaling. So inhibitor. So the pitch is the inhibitor of the hedgehog signaling. Now, what would be the familial syndromes? The familial syndromes, it includes the Gorlin syndrome. So this is in PTH, the Gorlin syndrome, Gorlin, Gorlin syndrome, and this includes the basal cell carcinoma, medulloblastoma, severe benign tumors. Next, in sporadic cancer, it can include the basal cell carcinoma, BCC, as well as the medulloblastoma. Now, moving on to the P10. The P10, it involves the phosphatase as well as the tensin homolog, the inhibitor of the PI3K, then also the AKT signaling, and it involves the Cowden syndrome, that is a variety of the benign skin GI CNS, and also the thyroid carcinomas. The sporadic, it includes particularly the carcinomas, the lymphoid tumors, and like the diverse cancers. Next, moving on to the SMAD. Now we look at the SMAD. So SMAD is, there is SMAD2 as well as SMAD4. So the protein is the same, and they are the component of the TGF. Component of the TGFB, and this is nothing but the signaling pathway. TGFB, and they are the signaling pathway, and also the CDK4 suppression induces of the CDK inhibitor expression. Then you have the juvenile polyposis. Now, sporadic cancers is frequently mutated. It is frequently mutated as a sporadic cancers, and along with other components, the TGFB, there is something known as TGFB. So this signaling pathway in the colonic and the pancreatic carcinoma. This is the sporadic cancers. To learn and grow daily like this, please do subscribe.